Gonna pull the curtain. Hello, my name is Danielle. I'm a student nurse here from Regis College today. I'm here to perform an abdominal exam on you today. While I perform the exam, do I have consent to film for educational purposes?
Yes.
Thank you. During this exam, I might be poking around for some tenderness, listening to the abdomen to assess the bowel sounds, and I might be tapping on you a little bit, but as I move along the exam, I'll let you know what I'm doing.
Okay.
Could I get your name and date of birth, please?
Kaylin Pacheco, 5902.
Just gonna check the wristband. Okay, and that matches up, thank you. So now I'm just gonna assess the patient's overall state of health. I see no signs of distress with the patient. The patient is laying back with the head elevated and knees raised for the purpose of the exam. The patient is odorless. I see no obvious color changes or lesions on the patient. Grooming is intact. Before I start the exam, I would do a radial pulse as a vital sign and assess the respirations, which is the rise and fall of the chest. I would assess the respirations for 15 seconds and multiply that by 4. An expected range would be between 12 and 20 breaths per minute. As for the radial pulse, I would feel that for 30 seconds and multiply that by 2. The expected range would be 60 to 100 beats per minute. All right, before we get started, Kaylin, have you experienced any nausea?
No.
Any areas of specific pain lately?
No.
Do you have any burning, urgency, or difficulty urinating?
No.
Do you have regular bowel movements?
Yes.
When was your last bowel movement?
Today.
Okay, thank you. Okay, and then I would adjust the patient if the patient was sitting upright and erect. Okay, Kaylin, do you have to use the restroom before we get the exam started, just because I might be poking your bladder and I don't want to make you uncomfortable?
Nope.
Okay, thank you. So now I'm just gonna lift this up, just gonna inspect your skin. So I see symmetrical coloring on the abdomen of the skin. I see no lesions, no wounds, no color changes. I see no striae. And then if I could lift the bed up, I would get to eye level and look at the contour of the abdomen. The contour is flat. And now I'm just gonna look at for aortic pulsations. Veins. Okay, thank you. And I see no pulsations or dilated veins. Okay, now I'm just going to take a listen with my stethoscope with the diaphragm side, and I'm going to go in 4 different quadrants of your stomach to listen to some bowel sounds. So I'm going to start in the right lower quadrant. And then I move to the right upper quadrant. Then the left upper quadrant. And then the left lower quadrant. Okay. All 4 quadrants are active and positive for bowel sounds. Next, I'm going to listen to 4 abdominal arteries with the bell side of my stethoscope. I'm going to start with the aortic, which is in between your xiphoid process and your belly button. So belly button, the xiphoid process would be here, so I'm going to go in the middle. Okay, next I'm going to listen to the renal. Then the iliac, just gonna move this down. And then I would listen to the femoral, but for the purpose of this exam, I can just palpate that it's right down here. Okay, so all 4 abdominal arteries bilaterally were negative for Brutes. Okay, next I'm just gonna be percussing, which is just gonna be me tapping. I'm gonna do that on all 4 quadrants of your abdomen. I'm going to start at the right lower quadrant, right upper, left upper, left lower. All right, thank you. Okay, tympani in all 4 quadrants. Now I'm going to start poking around on your abdomen again. So I'm just going to do what's called a light palpation. So I'm just going to go very lightly and just touch for some tenderness. And I'm going to start on all 4. I'm going to do all 4 quadrants. Any pain? I see no sign of pain on the patient's face while performing this too. Okay, so no pain. No pain or rebound tenderness for the soft palpation. Now I'm going to do deep, so I'm just going to be poking a little bit deeper. Still no pain, no tenderness?
Nope.
Okay, I feel no pain I feel no tenderness for deep palpation. Now I'm going to ask you to take a deep breath, and I'm just going to kind of slide my fingers under your skin just so I can try to feel for your liver. Okay, so I'm just going to move this up, and then the patient takes a deep breath, and then when she breathes out, I'm going to stick my fingers under. Okay, thank you. Okay, there's a non-palpable liver. Okay, and now I'm just going to ask if I could move you up a little bit. And do you think you could swing your legs over to this side?
Yes.
And sit up straight. Okay, I'm just going to pull up this shirt a little bit. Thank you. So now I'm just going to palpate for kidney tenderness on the costovertebral angle. I'm just going to go like this and go a knock. No pain?
Nope.
All right. No tenderness for costovertebral angle bilaterally. Okay, and that is the end of my exam with you today. Here's your call bell. I'll let the nurse know how the exam went. Thank you so much.
Thank you.